Hi there, I'm Dr. Chung and welcome to your friendly proctologist. Thank you so much for being with me. Thank you for all your comments and your questions. I truly appreciate your engagement into the channel. Will you please subscribe to the channel as well? This channel is meant to help people and I want to reach out and help everyone that I can. Just the main thing of why I started this channel is I realized I'm so different than all the other, well, I'm really different than a lot of the doctors out there in general, not just the people in my specialty. And so when it comes to the bottom end, having somebody who can really connect and having somebody who can answer questions with some detail so that people don't feel lost, I feel that that's the feedback that I'm getting that I can help people with. So again, it's really appreciated that you like the video and subscribe. So today's topic is about tailbone pain. And tailbone pain is something that really, not many people talk about either, right? Our anus is one thing, but the tailbone, I mean, we know about other bones and other parts of our bodies hurting, like elbows and stuff like that, but what about our tailbone? And there is a name for that. It's coccygenodynia. And the coccyx is the tailbone. That's the name of that little, it looks like a little dinosaur fingernail. And that's connected to the spine, which it is connected to the very bottom part, the sacrum, right? And this little bone can cause lots of issues of pain for people, okay? And it's very confusing when it comes to this pain because a lot of doctors will think it's hemorrhoids. And it's not to the fault all the time of the doctors. It's not like I'm saying that they're not listening to you, anything like that, but many times I find that patients describe their pain as their anus or their rectum. So how else is that going to be interpreted, right? It's something that has to be teased out, because if the pain is thought to be the anus, then hemorrhoids are likely to be first on the list, or a fissure maybe, and the wrong treatment may be advised. And so it's crucial to get the right diagnosis, right? How do you get the diagnosis of coccygenodynia? Wow, good word. It's a long one. But the diagnosis is actually pretty easy to figure out, okay? All you need to do is just push with your own hand and really pay attention to the structure that you're pushing on. So don't use your whole hand and push on it. Use like your finger pad, your fingertip is even better. Fingertip and push on the thing. So let's say I have pain in my finger, okay? And you're telling the doctor, Doc, I have pain in my finger. And the doctor is going to be looking at you and say, well, what part of your finger? And so the doctor will start pushing on little parts of it at a time, and you'll say yes or no. But here, and also the bottom part here too, right? So on your tailbone, I would start out on the back side. Start above your butt crack and kind of go straight down that bone right in the center of your bottom end, okay? And when you go down, start to go down to your butt crack, keep feeling for that bone, again, using only one fingertip so you really understand where it's hurting you. And when you get very close to your anus, your coccyx is right in that neighborhood, okay? The coccyx is only maybe about 4 centimeters away from that anal hole, or even less in some people. So very close, okay? And that coccyx also, it can curve into your body. So it's not like it's level with your skin. Sometimes it curves down your back and then makes a little upward turn, so it's almost hidden. So that's why, again, it's really important to use that fingertip. So keep following that. But as you get closer to your tailbone, your coccyx, you may start to feel some soreness, because when the coccyx is moving, then you may feel some, some ringing in your ears, right? And once you hit that point of the very tip, and you may need to really push into your skin to really feel the very tip of that coccyx, then you'll know whether you have tailbone pain. All right, but I wouldn't stop there. Keep going. So go towards your anus. Use a glove if you have to, but keep going towards your anus hole. There is a ligament, okay, a series of muscles and tendons that actually connect your tailbone to your anus, okay? And that can be confusing because maybe it's not your tailbone that has pain, but maybe that connection, the ligaments and muscles that connect the tailbone to your anus. So you see how each one of these is a totally different problem, but it can change the therapy, and it can change the diagnosis, right? And the other thing too is see around the tailbone. There's fat on either side of the tailbone. Maybe it's actually the muscles of your pelvic floor that are causing pain. So what you could also do is kind of push around it. So it's not the bone that's causing pain, but outside of the tailbone. That's what's causing pain. And you can try on the left and the right side. Really try and push deep into there. And you'll feel like it's kind of like a, it's not like Play-Doh or anything like that, but you'll be pushing on the fat of your bottom, and you're not going to feel any bone. It just feels like it just can keep going in there if your skin weren't there. And then you're pushing on the fat inside your pelvis and the pelvic floor, those pelvic muscles that form the bowl of your pelvis, okay? So what about treatment for tailbone pain? Well, in the textbooks, it's mainly about getting pressure off of that tailbone to stop irritating it, and taking medications for pain, most notably non-steroidal, something like ibuprofen, naproxen, things like that. Those are a lot more effective than usually Tylenol, but Tylenol can also be combined with that. Ice packs, heat packs. This is the one time that I'll say donut pillows may work, because sometimes some people don't have enough buttock fat or buttock muscle to keep the tailbone pressure off, right? If you have a bigger butt or a deeper butt crack, that tailbone is not going to be sitting on the cushion here. It's actually going to be sitting off of it. But if you don't have a lot of buttock fat or buttock muscle, then you can see that when you sit down, the pressure will be right on top of that tailbone. Almost you're resting or sitting on your tailbone directly, which can definitely make that tailbone really mad at you, right? And it makes it difficult to sit or get into a comfortable position. What are some other treatments? Well, injections are also done too, like steroid injections. Try to decrease the inflammation. Also, numbing medications like lidocaine injected in there to try and numb the pain for a little while. Another type of treatment really is physical therapy. We talked about how there's tendons and ligaments that connect the coccyx to the anus. Well, the pelvic floor completely surrounds that bone with muscle and tendons. And so when the muscles are pulling, when they're contracting with the pelvic floor, it pulls the tailbone either way or both sides. And so you may get some torquing and twisting, especially when you're doing certain movements. And physical therapy, I'm a real big believer in it. I mean, I try to exercise at least 3 or 4 times a week and really get all my body parts moving, doing lunges, not just lifting weights to get an upper body, but really to try and get my pelvic floor strong, because it really has so much to do with balance, so much to do with pain in your lower back. Anyway, I'm getting a little off topic, but physical therapy is something that I would also advise trying. What's another one? Well, it's really a last resort treatment, which is surgery. The surgery for tailbone pain that does not respond to medications, injections, physical therapy, and the pain is so bad that the person can't seem to get on with their quality of life. I mean, we're talking about really serious pain that tried everything, seen a lot of doctors, and it's not working. That surgery is actually to remove that bone, right? So if you take out that bone, you're hopefully taking out that part of your body which is carrying that inflammation, and therefore you're removing that signal from your brain. And that is partial. That can be very effective for some patients, but other patients, it may not give that kind of relief. So again, it is not one we can recommend at the very beginning or at the outset. Surgery is only used as a last resort. So I hope this video finds you well, and I hope that you're doing well and dealing well with your issues, and I will see you on the next video. Thank you so much. Take care. Bye-bye.